Rafael, you've been probably one of the biggest advocates for the use of VR in surgery. Where would you say the field is today compared to 5 years ago? So what are the latest things that are new?
I think the field of XR in general, VR, AR, mixed reality, MR, has grown tremendously in the last 5 years for sure. From the hardware perspective, having devices that are much better, much faster, smaller, lighter, better battery life, better field of view, better resolution, and especially better cost. I think that the availability of devices today compared to 5 years ago, it's a day and night. I think that finally the healthcare industry, from education to diagnostics to therapeutics, but especially education and diagnostics, have embraced the use of XR, and it's still very early, but more and more you see a lot of places where it's being used for medical training, for nursing training. I think it's really spreading very, very quickly. And the therapeutic side of things, you see now thousands of validation studies for the use of VR, especially for depression, for anxiety, for PTSD treatment, for perioperative pain control, and you name it. It's really, and it's not just the potential. Now you have actually scientific evidence that it does work as good as or better than some of the pharmacology that we have for these problems. So I think that it's very interesting what's happening right now, and people is looking into the future, and I think that as the hardware and the software progresses, and we are able to also democratize the access to these tools, I think that is going to be really fascinating.
When it comes to the adoption of technologies in the clinical practice, it's usually not as much of a problem with technology, but about culture, about how you are going to do the training of all the staff, how are you going to convince the staff that they have to change their ways of working. So from the practical perspective, do you use it like in your everyday practice? What are the practical implications there?
Yeah, I don't use it in my everyday practice yet. I live in the US, and the regulatory culture, the administrative culture is a bit difficult to navigate in certain places. It depends on where you are. If you're in a big academic place, sometimes that's a little bit easier. But where I am is an academic but small place with a community hospital flavor, which is great because I get to talk about this quite a bit, but I don't get to use it as much. I use it mostly in education. I use it with patients and with students, and from XR tools to point of care devices, point of care ultrasound, to the integration of mobile technologies or wearables into the flow of healthcare. It's interesting to get the newer generations of nurses, of students, of residents to extend their curiosity to what is this about, because by the time they finish their training, this is going to be pretty common use tools. And there are many places now where it's being used clinically on and with patients.
Mm-hmm. And is the medical education system already embracing this as well? So to which extent do you see that the curriculum is changing so that students actually learn already during their studies about these technologies, and you can expand this to other innovations in digital health as well?
I think it's changing. It's changing certainly fairly fast, I would say. 5 years ago, barely anyone was doing this. Let's talk about medical school and VR, for example. You had Case Western Reserve that were using HoloLens 1 to use that for the anatomy lessons, and they had a small group of students, I think, that got the device and were practicing anatomy lessons in VR. But now you see many other places that are embracing that technology. There are several universities that have built simulation centers or places where they actually have an area specific to XR use, from VR to mixed reality. In nursing education, there are several platforms out there. There's a platform called Bundle of Rays, which is a specific VR training for nurses. There is Fundamental VR, that is, as you probably know, a surgical training in certain specialties, from ophthalmology to neurosurgery to orthopedics, but also putting that into the curriculum of learning how to set up a room, for example, a robotics room where you have a nurse or a technician at home with a device, and they're learning how to set up a versus a robot, for example. So all of that is becoming a norm in many places. You have places, for example, Maine, there's a university in Maine called Bill University, and they have a very strong nursing program. During the pandemic, they were really beefed up because their curriculum, a great deal of their curriculum for the training of the nurses is in VR. So they could actually train a nurse in 18 months rather than the time that it usually takes. So they have a very high bar to join the program, but once you are there, a lot of the stuff that they can do virtually in a big sort of warehouse with all VR equipment, they do it, and they can skip time and really get the nurses trained as well, but faster using VR. So all of that is becoming very, very clear to people, and I think the hospital systems, the academic places are seeing that there's no reason why we can't do this, so they're embracing it, I think.
Mm-hmm. And what are your expectations in terms of the future? What do you see as some of the potentials that still have some barriers before they're going to be realized, and where does most effort need to be made for the greater adoption and use of VR or extended reality?
I think it's hard. I think there are many fronts, and the main thing is culture, the change of culture, the education. I think that's why I'm a full-time clinician, as you know, but I love going out there and talking. Every month or two, I try to find a place where I can make a difference and go and impact the minds of people, to the people from users to administrators to regulators to clinicians, where you can really present to them, a barrage of ideas of what's happening here, what has happened, what will happen, and then you gotta basically surf this wave today, otherwise you're gonna miss it.